Good morning, Mimi, and good morning, Melissa. Thank you so much for joining us today in this new series that we were going to be putting out on our website in spirit of being proactive and helping our community deal with some of the stress, fear, and anxiety around the war and what's happening in the world right now. As members of our community and professionals, I'd just like to formally introduce you in case anyone listening does not know you. So, Melissa, Dr. Melissa Sporn, thank you for joining us. Melissa is a dedicated scholar, practitioner in clinical psychology. She has a master's in social work and a PhD in clinical psychology. So, I should actually call you Dr. Sporn. My apologies. She balances her time between her clinical practice, training. She does some consulting and connecting with children and her children. She's actively involved in the mental health committee of Safe Community Coalition, which is a nonprofit organization addressing stress reduction, mental wellness, and youth empowerment. Dr. Sporn employs cognitive behavior therapy. Some people know it better as CBT. It's an evidence-based treatment, and she uses this in her work with young adults and adolescents. She is a sought-after speaker on adolescent development and family relationships. And she engages frequently with workshops, schools, organizations, and now working with us. So thank you again, Dr. Sporn, for joining us today.
Thank you.
Great. And then we have Mimi. Thank you, Mimi, for joining us. Mimi is a licensed clinical social worker providing psychotherapy services to families, individuals, and couples, as well as adolescents. She does training, supervision, and program development, has been doing this for over 25 years. Mimi also is an adjunct professor at George Mason University, focusing on families and clinical work. She has a master's of education from Antioch University and a master's of clinical social work from Simmons College. So thank you. We have two wonderful community members and practitioners to join us today. So thank you. So, as I mentioned earlier, we're putting together a series of videos for our community in the hopes that we can be proactive and help our community members deal with some of the fears, the stress, and anxiety, even communication issues around the war. And some of the questions that have come in, they come into the clergy or they come into myself, and we really are looking to lean to you to help us understand how we can advise or how we can help our community members. So one of the questions that we frequently receive is around this idea of having different perspectives on the issues of what's going on now with different generations. So whether it's a grandparent and a grandchild or a parent and a child, and, can you help us figure out or give us some tips or advice on how to really work around differences with people that we love? And how do we maintain those relationships when we have such differences? So I will turn it over to you.
Mimi, do you want to start?
Well, when Melissa and I were talking about this yesterday in preparation, and just we kind of blurted out the first things that came to our mind. And the first thing that came to my mind, because I'm visual, is a Venn diagram. It's, this person cares about me, I care about them. What's the intersection that we always had going forward because we're friends or we're connected somehow? And to remember what are the things that connect us, not just focusing on the things that are disconnecting right now. So that was one of the thoughts we started to talk about.
Mm-hmm. I think that when we feel we're in relationship with somebody who has a difference of opinion with us, and it's something that we hold very dear and hold very strongly, immediately we feel as if the relationship has, been severed in some way. It's almost like an assault to the relationship. And I think starting with an openness and a willingness to communicate, to engage in dialogue and to hear each other's viewpoints, and I say without judgment, without shaming, without sort of accusatory, but rather just being open to hear perspectives. And, I approach it from sort of the anthropologist or sociologist perspective. I just want to learn where you're coming from and understand your perspective to better understand you.
And it takes a lot to do that. Sometimes you need to just take a deep breath because your anxiety gets enacted and go with being curious. So where are you coming from? How did you come to this thought? Asking open-ended questions, those are ones that can be answered not just with a yes or a no or a one word. It helps expound and expand on ideas so that we have better understanding of where people are coming from. The other thing that Melissa and I talked about is that the goal is not to convince or prove the other person wrong or me right. It's to preserve the relationship, because as you stated to begin with, Stephanie, this is usually somebody that I care about, I'm in relationship with already. And when somebody in our close knit or that we feel a connection to is pretty different in their thinking about something than we are, that just throws our gyroscope off. We talked about that a lot.
And I think focusing on the positive aspects of the relationship, what are the things that unite us versus the things that divide us? And in this unbelievably polarizing point in our history, it isn't shocking that over the past 10 years, we have become more polarized in our thinking. And so some of us have encountered this before, whether it be at the Thanksgiving table in 2016 or during COVID, having family members who were anti-vaxxers, or, it is recognizing that the focus on the relationship and how do we maintain the relationship, and perhaps even agreeing to disagree. Recognizing that there are times where, while I wish we could have these conversations, if they become heated, if they become hostile, if we can't kind of cogently, thoughtfully, constructively communicate, that sometimes it's better to table this one and say, okay, we used to say we don't talk about politics or religion at the dinner table. Like, this topic may not be something we can discuss for right now. And then kind of, agreeing to disagree for this.
It sounds like the key things that you're addressing are the sort of this grounding, first grounding yourself, right? Knowing that we need to feel grounded. We know that when there's a confrontation, there's a threat, right? So it's whether a threat to our beliefs or a threat to the other person. That's when we start to get into sort of arguments. And it's not necessarily a need to win, but I think it's about a need to feel safe. So with feeling safe with the person that you love, even when you're different, the key points, it sounds like, are being grounded, finding the connection, and also a little bit about having boundaries and saying, you know what? Why don't we not talk about this? We can agree to disagree, but this doesn't feel comfortable. And maybe even I love you. I love you. I care about you. I know you love me. And maybe this is not the best time or place to have this conversation.
And I think that that's a really good point. You're talking about the various kind of topics, and I would add empathy there.
Yeah.
The concept of empathy, of understanding that we're approaching this from different perspectives, but each of us have very strong feelings about it. So, and that when and where we may be able to have this conversation, but it is the when and where. And right now, when it's heated, or when I'm feeling passionate or vulnerable, or, my bandwidth is limited because of other life events and struggles, it isn't a good time. And I may not be as open.
And we all want to be heard. And we all want to be listened to. We also do want to be agreed on. So that's just honest. We usually do. But we really want to be heard. And the other thing that has come to mind is we've been through a lot in terms of an election a few years back and COVID. And those are not things that we wanted. And those are things that we had pretty strong disagreements about in families and with friends. So it's not as if we haven't had to figure out how to have conversations and stay connected. We've already been doing that. So I would ask people to really stop and do some analysis of themselves. What's worked? What hasn't worked? Where have I stuck my foot in my mouth? Where has somebody offended me? What would have been better? How do I volley back? Do I bother volleying? Asking yourself these questions, since we have been through a couple of crises before.
Mhm.
And I think focusing on the ultimate goal, which is maintaining the relationship and keeping that connection. I think stepping into uncomfortable conversations can be hard, but sometimes it is just about saying, this is how I feel, and valuing and respecting the other person's feeling and acknowledging we don't always have to agree. That in relationships, one of the beauties of having a relationship with other people is hearing diverse viewpoints and perspectives. And we
Great
get so
point.
siloed and so comfortable in our silo. And that's not necessarily good. It doesn't help us grow, it doesn't challenge us.
And there may be times when, and Melissa and I talked about this, we make the decision to stop the relationship or stop it for now. As adults, we've learned relationships go in and out. That there's fewer people that are always on our line with us.
Mhm.
And so maybe this is one of those times when you take a little bit of space, or maybe it is a time when this is so disturbing to a person that you make the decision to end that relationship. And then you have to deal with more mourning and loss and grief, which I think a lot of people are dealing with now because of what's going on in Israel and Gaza.
And I think as well, even one step before that might be the potential to seek mediation. If it's a family member, to bring
Mhm.
somebody, a clergy person, a therapist, a friend who can mediate and assist you in having this conversation that
Mhm.
might matter a lot. Who's a little more even-headed and less emotionally embroiled in it.
It's almost like having the right skills to communicate, holding the space for one another, respecting the relationship, and learning about the right skills or words to say. And on that note, I'm wondering if either of you could recommend, a phrase or something that along the lines that says, I hear you, your truth is your truth. Kind of my truth is mine. And what would be the next piece of advice to bridge that conversation so you both walk away feeling safe? Any thoughts on what would come next?
So I have said to friends, we can agree to disagree. Like,
Mhm.
I love you and I respect your perspective, and I may not agree with it, but I absolutely respect your right to have that opinion,
Mhm.
right? And to see things the way you see them.
And how do you move on from that? That's, sometimes they're words, right? They're just words, but that feeling still stays inside of you when you walk away from that conversation. You'll say, okay, I learned that tip. I have that tool. We said what we need to say, but now I'm dealing with the ramifications of having a very different perspective and I feel all heated up. Where do you go from there?
I remind myself that I'm not always right. That time has, on occasion, don't tell my husband this, proven me wrong. And so while I feel very right in this moment and very, again, the friendship and the continuity of the relationship is more important to me. And I value that more than being right.
And I would add that if I still had that fervor in me, I would go and talk to someone that I knew I had an alliance with. And then I would hope I could do some of what Melissa's saying, but also remember the gratitude and how I do feel about that person.
Right, the gifts they give to me.
Yes.
That's great. And right, even maybe just remembering once you walk away, to think, what am I grateful for in this relationship? And maybe even sharing that too, sharing it back. I know we're different. We both may feel this way, but thank you again for being you and all the years that you've done this. Or thank you for the text yesterday that said good morning, something as simple as that.
Yes,
Okay.
and we're all hurting about this one way or another, regardless of if there is a side or if you're in the middle, if you're in the and or the but. We're all hurting about this.
Good, good. Well, thank you. Thank you. Another question that comes in, if we can move on, there's so many questions, but today we're just going to address 2 questions. Another one that comes in is, how do I manage my own anxiety as I work to support others? And this ties into a little bit of what we're saying, that anxiety which sits in our body. But what do we do with that when we are the one who's, especially if we're a parent, right? And we're trying to make sure our children are okay and managing their anxiety. What would the parent, what advice could you give to a parent or a grandparent or someone who's in a different position of taking care of someone?
So I always say, being a caretaker, you have to take care of yourself, right? So it starts with self-care. That if I'm not taking care of myself, I don't have the capacity or ability to take care of others. So to start with, I would look at, what am I doing to bring joy and happiness into my life? What are the things that fill my bucket? You know, and really looking at, I sort of talk about 4 pillars, that if they're not kind of strong, robust, the house falls. And exercise, eating right, sleeping, and socializing, getting out and doing fun things. Like, we again get pretty focused on the issues of the day, but you know, go bowling, go to a movie, go, you know, ice skating or
Play, right? In this
Very
crazy
important.
hectic world, how can we bring in play, especially as adults, and just let go a little bit?
Yeah.
Right, and that idea of letting go, I love too, because it's that which I can control, what is within my purview. Like setting realistic expectations. I can't do everything, I can't be everything for everyone. And really recognizing what are my limits, and when do I need to say no, and how do I set boundaries?
Absolutely. Recognizing our own uncertainty and discomfort. There is fear right now on many different levels for many different people. But do I want to live in a fear-based living or a hope-based living? And choosing hope is what we're all about in our professional lives. And we also need to make sure we do that in our personal lives.
It's a deliberate choice almost the minute you wake up to say, I could do this or I could do this, and I'm going to choose. Some people, it's easier for them to just walk into that space of hope. But for others, maybe who struggle, it's like, how do you find that and how do you intentionally find that? And maybe it's not scrolling through every news article or but in choosing intentionally that I'm going to focus on hope today, because that hope will help me manage my anxiety, which then means I can better care for others.
When Mimi and I spoke, we talked about limiting news consumption. Idea that, are you guys hearing an echo?
Yeah.
So limiting news consumption and recognizing that whether it's I have to get off social media for a period of time, or recognize, or finding a specific time during the day where I can consume it, but setting a time limit, that we do
Mhm.
this doom scrolling. And there's so much available online, and we do kind of get, again, siloed. So the algorithms of social media send us more messages that are confirmatory, that are, reinforcing our beliefs and our thoughts, and get us more hyped up. And so recognizing sometimes we need to take a break from that, and curate, sort of joyful news. You can Google happy news stories, and there are lots of them.
Puppies and kittens, puppies and kittens.
Yes.
Absolutely. And then, I know it's sort of a buzzword these days, but mindfulness, taking time to meditate or do yoga or go for a walk and really take in nature, to just sit and listen quietly to your breath. It can really help ground you. And if we're caring for others, grounding ourselves is critical to helping them be grounded.
Absolutely. Another thing we can do is look for glimmers. Glimmers are these teeny little bits of moments. Like you look outside and it's snow and you see a red cardinal and the red stands out. Okay, but not things aren't right with the world, but in that actual moment, I want to be able to take that in. You know, when my kid comes home and gives me a big hug, I want to be in that hug in the moment. So looking for little glimmers, not to push stuff under the rug, but just to offset maybe a little bit of rebalancing.
Great,
One of the
great.
things I was thinking about is, especially during this time, seeking support, that one of the pillars is social, right? Getting out, having fun with friends, recognizing that in our friends group, we do a lot of kibitzing about stressful things, and saying, we can talk about this for 15 minutes, but then we're going to talk about all good stuff. We're not going to just sort of jump on the worry wagon, or, sometimes I call it the stress Olympics, and just talk about all the things that are stressing us out, because it actually doesn't always make us feel better to hear about other people's stress.
Right.
We think it helps get it out, but actually what really helps is kind of talking about fun things and happy, joyous. So I talk about the roses or the glimmers.
And that's okay, right? I mean, I think sometimes people feel guilty for, saying, I'm not going to talk about this, or I'm okay right now. But maybe what you're saying, it's almost contagious, right? Maybe that person who isn't full of anxiety, who is sort of grounded and peaceful in all this and kind of feels that things will work, and it's okay to be that person, right? And maybe not have an excuse for why you're not feeling so anxious, or and maybe you're the one that people need to be around, is that grounding force. So yeah, bringing those moments of positive energy, positive emotions, and groundedness to others is really right. And it doesn't need to be sharing and hoping. And it's almost like sometimes it doesn't even need to be said. It's just something you do, right? Like, let's go for a walk together, or let's choose to look at the red cardinal in the snow. Let's choose this.
And I also want to add that if that kind of talking isn't enough, that there are therapists out there, there are counselors, there are clergy, there are people that maybe aren't living in your circle that are away from it that you could talk to. But to remember to reach out, especially in this kind of time.
Absolutely.
Just
Absolutely.
get assistance if I'm not developing or have an adequate sense of coping strategies. Yeah, I can go to my friends and, how are you coping and what are you doing to cope? And that's a very different question that aren't you stressed out by? Like, what are you doing to cope? What are you doing to feel better right now? And also there are resources in the community, therapists, clergy, who can assist us in developing coping strategies, or coming up with, go to the temple and play mahjong. There's a lot of things that goes on in the room.
The other thing,
how would you? Yep, sorry, go ahead.
The other thing a person can do is put that worry and all that energy into action. Go to a protest, write a letter, join a group that's doing, videos, to help people feel better. Educate yourself. Action is really important. That the physicalness of doing something.
Right. I think
And
for one side, it gets you out of your head, and the other, it gives you a sense of control that you are doing something.
I'm going to
Mhm.
recommend, Mimi said, educate yourself. And I think educating yourself about anxiety and how anxiety works. There's a podcast called Therapy in a Nutshell by Emma McAdam. And I think it really does a beautiful job of kind of walking you through what anxiety is and what it does and how to combat it. The other one is Flustercluck. I have to be careful how I say that.
That's
By
a great
Lynn
title.
Lyons. She has a podcast, Lynn Lyons, and that's really wonderful for parents who struggle with anxiety or who have children who struggle with anxiety. And not shockingly, parents who struggle with anxiety often have children who struggle. So Lynn Lyons really does a nice job on her
Okay.
Flustercluck podcast.
Cluster clock. Okay, we will make
Good
sure to
job.
get that right.
Flustercluck.
And how would you advise someone? They feel like they're anxious. They're not sure whether they need that additional extra professional help. What are some tips you could give to our community that say, okay, these are some of the warning signs that you might, be moving from just being a little anxious because the times, or I might really be struggling. What would you say to anyone in our community? Hey, look, it's time to maybe consider going for professional help. What advice could you give on that?
I think pay attention to sleep. Too much, too little. A lot of the things that we look for when we screen for depression and anxiety, what you're eating like, too much, too little. Are you using, recreational substances too much or at all? To really kind of do some self-looking. Are you worrying? Are you finding that, you're grabbing your worry stone metaphorically or really all the time, that's the only thing you can talk about, that it's invading, you're not able to come up with a glimmer or a hope. These are some of the things. I'm sure Melissa has others to add.
Yeah, I would say
Great.
it's intervening in your social engagement, in your work or school life, that you're having difficulty concentrating, planning, organizing, things that, what would be your typical functioning is becoming somewhat impaired. Avoiding, right? I'm avoiding social, if you're getting invited to holiday parties and you're just saying, I don't want to go.
Mm-hmm.
So those things that previously brought you joy are not bringing you joy. And they're sort of, that cloud, is that Pigpen has the cloud over him? Sort of that walking around with this little metaphorical cloud over me all the time. Or this pressure that's inhibiting sleeping, eating, as Mimi said, and the general functioning.
So really checking in with yourself, really saying, okay, how are my daily habits?
And
And
sometimes these
if
things present in symptoms. I'm having a lot of stomach aches with unknown origin, or headaches, stress in my shoulders, and pain in my, literally a pain in my neck. Sometimes those are stress related. Sometimes they're medical.
Great.
So get that checked out first. But if they're not medical, often it's psychological.
That's really good advice. Thank you. Thank you. Knowing that, yes, it's a time that we might all be anxious because the anxiety comes from not feeling a sense of control, right? But when it starts taking over and the worry becomes fear to do anything, or kind of impacting our sleep or, our daily lives, we know that it's more than just a little bit of worrying and a little bit of maybe expected anxiety in such a difficult time, but it's crossing the line that we might need some help.
And you can always call a therapist and just talk. A lot of us do 20, 15-minute, 20, just check in, see how people are doing. What do they need? It may be a support group and not therapy. It may be group therapy instead of individual, but you can always do that. And many of us are willing to help somebody kind of evaluate where they're at, a quick assessment, so we can refer to what they need.
Oh, great, great. Thank you. And I know that I asked two very big questions and important questions, and thank you so much for your professional advice and your time in answering these. But before we wrap up, are there any other questions that you've heard, maybe in private practice with your own clients, that have come up over and over again that might be worth sharing with our community that I haven't quite addressed in this session? Anything come to your mind?
Well, you touched on it in your last comment, this concept of fear.
Yeah.
And, I think one of the things that we're seeing is sort of this almost overwhelming, all-inclusive fear that exists, but isn't necessarily real and is definitely not helpful. Like I find myself saying a lot, feel the fear and do it anyway, to patients, to myself, to my kids, that my daughter sort of coined, feel the fear and persevere, you know, and that idea that we are fed in news, news sells clicks or sells views through fear, right? If you see the bylines of the news, it's like our next story, and it's really to hook us, and fear hooks us really well. Politicians hook us with fear, to the voting booths. So we're being sold a lot of fear messages, and I don't know that they're real or helpful. And I do think, in talking to my Israeli family, they say two things that really buoy me all the time, which is I have to live my best Jewish life. And that, terror wins when fear inhibits our behavior. So we really have to go out and live well.
Thank you. Thank you.
Mimi, what about you?
Mimi?
That was beautiful. I have nothing more to say. Living our best Jewish life, figuring out what that is for ourselves, and having other people around to do that with.
Great. Well, thank you so much again for your time. And I know that this is going to be a tremendous help to our community. And moving forward, we hope to, again, be proactive and bring space and professional opinions and advice to our community when they might not have the opportunity to reach out on their own. So thank you again. And today, move forward and have your best Jewish life today.
I'm going to interject and say on behalf of the congregation, thank you to you, Stephanie, for everything you do and how you show up for all of us.
Yes.
That it's so important, especially now, to have you be a part of our community and doing the things you're doing. So thank you for scheduling this and providing this as just one more in the tapestry of everything you provide.
I appreciate being included and being able to do this with Melissa.
Wonderful. Wonderful.
Thank
To
you.
another time. Thank you and have a beautiful day.
Thank you. You
Thank
too.
you.
Bye.
Okay, wait. I'm going to show you my chavas before you go.
Stop recording.